All right, so let's touch down seriously on something that is very, very crucial to the well-being of our children and, of course, by extension, the well-being of everyone too. So we are trying to understand and address ear discharge in children. So we're talking ear care this morning, and I have someone who's a specialist joining me in the studios. Dr. OBEBE Francis AMEH is an ear, nose, and throat surgeon. We call them ENT. He's an ENT surgeon with the RJOLAD Hospital, and is right here in the studios. Dr. AMEH, good morning.
Good morning.
And how are you doing?
I'm very good, thank you.
All right, so let's touch down on, what we are really looking at this morning. We're talking about our children and how we can care for them. But talk to me, ear care, or perhaps the discharge in ear. What is it really, and what causes it?
All right. First and foremost, I'd like to thank the management of this great FM for inviting me, and as well, I'll also like to thank the management of my hospital, RJOLAD Hospital, particularly founder and director, Dr. Oladipo, and MD, Dr. Fashina, for the opportunity.
Right.
I'll start by telling you a brief story, very short one. Growing up as a child, I had this very good friend who at the time developed bilateral ear discharge. That means he was discharging copious mucus from the ears? From his ears, both ears, actually.
And this was your friend?
Yeah, very, very good friend.
Wow.
And his mother, managed it
somehow.
Yeah, in her own way. I remember she used to wash with soap, apply all sorts of concoctions.
Wow, into the ears?
Into the ears. And, gradually we got into secondary school, and, eventually he started performing very badly in school.
Right.
It got to the point that he could not hear completely.
Wow.
As I speak to you.
So this was a constant thing.
Yeah.
From time to time, you have this discharge coming from the ears.
Exactly.
And we just felt this is normal, right?
This is normal. It's normal. It's something that will go. But, eventually he lost his hearing in both ears. As I speak to you, the last time I saw him, he was completely dissociated from the society because he could not hear.
Right.
And I'm sure he's having some mental issues, definitely. Depression will come with it. And then this was somebody who had, dreams. Now the dream has been killed off. I'm sure there's no organization that will want to employ him because, one, he has not been educated.
Right.
Because of the hearing loss. And then, of course...
Well, there's still hope, really, because I know that government has set up a lot of institutions that are rehabilitating persons with disability these days and trying to ensure that they are properly integrated into the society. But this is a very, very touching story, and it aligns with what goes out there. I mean, we have so many people that are in these same kind of shoes, right?
Yeah.
And that is why we're talking this ear care this morning. So talk to me, this ear discharge is not normal, right?
It's not normal. You see, actually, the ear has three parts. We have the outer ear, which consists of what the lay people out there will call the ear, the one by the side of the head.
Right.
And then you have that hole, which is the ear canal that leads to the eardrum.
Which is the middle ear, right?
Yeah. So from the eardrum, you have the middle ear, which contains structures that help to conduct sound to the inner ear, where you have the cochlea that help to receive the sound, process it, and send it to the brain.
Okay. Now,
ear discharge can arise from all these parts of the ear. From the inner ear, mainly the ear discharge that comes from there is clear fluid, which is likely CSF, cerebrospinal fluid. That is the fluid that surrounds the brain. That pretty much you see in people with trauma. So that is actually not the real discharge we're talking about today. The main one that we're worried about that often causes hearing loss is the one that comes from the middle ear and sometimes from the external ear.
Is there a way one can distinguish which kind of fluid is this?
Yes, the one that comes from the middle ear is usually mucus. It looks mucoid. It sticks. Okay. Yeah, because the lining of the middle ear is the same as the one you have in the nose and other parts of the upper respiratory tract.
Like the throat as well?
Yes.
Okay.
Then the one that comes from the outer ear is usually serous, sometimes occasionally stained with blood, depending on the extent of the disease. Okay.
That's the one in the outer ear?
Yes.
That one is lighter, right?
It's lighter. It's serous, sometimes clear, sometimes bloody, kind of. So that is lighter. But the one that you often see with children and parents neglect and all that, you see it mucoid, you understand? And these children carry it along just carry it along like that. Parents neglect it,
and they feel it's normal.
It will go away.
All right. So, Dr. AMEH, so how common is this ear discharge in children in Nigeria, for instance? Can we put a figure to it?
It's a very, very common thing, I assure you. It is said that 1/3 of children will have at least two episodes of ear discharge in their lifetime. The WHO estimated that currently in Nigeria we have about 40 million people with hearing loss.
40?
Yes, and this is projected to increase to about 70 million in 2050. All right, if nothing is done about it.
Well, so now we're much more concerned about children. So we're talking about ages now. Which ages? Babies, right?
Yeah, from neonates to, that is the first month of life,
right,
up to about 7 or 8 years.
Yes, these are very, very delicate times. Very, very, times that people will just begin second guessing as what is happening. You know, if it's an adult, he can tell you, well, I'm feeling pain inside the ears, or this part of the ears is blocked, or that kind of thing. But for children or perhaps babies, it's very, very rare to be able to decipher what's going on, really.
Yeah.
So, what causes it, doctor?
A variety of causes. Okay. First, I look at it from those factors that are inherent on the patient. Okay, we're talking about some anatomical abnormalities. Sometimes some babies are born with what is called a cleft in the roof of the mouth. In that case, each time they feed, the thing goes back to the back of the nose, and that way, it causes obstruction of what we call the eustachian tube. The eustachian tube connects the middle ear to the back of the nose. So constantly they keep having repeated ear infection. Okay. Another thing that commonly causes ear infection with subsequent discharge in children is what we call adenoidal enlargement. This is seen usually in children between 2 to 5, 6. By 7 it begins to regress. This is like a lymphoid growth behind the nose of children. When it grows too big, sometimes it obstructs the eustachian tube, and these children come down with repeated ear infection, and subsequently they come down with ear discharge.
Right.
Okay. The others are systemic diseases. If you have a child who has a sickle cell, for instance, a child with retroviral disease, HIV, their immunity is suppressed and so on. So they will constantly be having these kind of things. And then children who get all these immunizable diseases, such as measles, pertussis, these are all immunizable diseases. And when these children contract it, they can come down with otitis media and eventually have ear discharge. So these are the causes are numerous, and then we have others who consistently, put objects in their children's ear in the name of cleaning the ear, which is a wrong practice, because the ear cleans itself. Actually, you don't need to put any object there. So we've had cases where, mothers accidentally perforate the eardrum. Wow. Yeah, and before infection starts. Okay,
so a lot of times when mothers, or perhaps when they assume that this might be what is wrong, they head straight for the cotton bud just to clean the ears.
Yeah.
Is that a good practice?
It's never a good practice.
It's not?
It's not a good practice at all, because first of all, the cotton bud you're using is not a sterile thing. And then that is not the scientific or medically based form of treatment. Okay, when you come to the hospital, we have scientific and evidence-based way of treating otitis media. In fact, quite often when children have this ear discharge, these parents, apart from applying all those traditional things I told you, they could take them to the chemist, what are people call chemist? That is patent medical store.
That's right, a lot of times.
And then what they give them is commonly is gentamicin eardrop. And researchers have found out that eardrop is ototoxic. that means it is capable of causing hearing loss.
Wow.
Okay, and in any case, when a child has ear discharge, we don't just, begin to drop eardrop. Okay, there are things we do in the hospital. We clear the discharge, we do dressing
before you even apply any drugs.
Exactly.
All right, so doctor, let's talk first about the complications that could arise from this frequent discharge, ear discharge, as we're talking about it now. What are the things that could arise? But even before then, let's distinguish again. You said there are differences between the kind of things that could be discharged from the ears, right? Now, the first is the one that you said is very, very thick.
Yeah.
So if we see that one, what should you be scared?
I think not to put fear in people's mind, but I think we should be worried.
Okay.
We should, if your baby's ear is discharging, you should be worried. What it means is that the eardrum has been perforated. In fact, we shouldn't have even gotten to that stage in the first place, because when a baby is having ear infection, the first thing they complain of, if the baby is old enough, he'll tell you, "Mommy, ear pain." Okay, for those that are not old enough, they'll be crying excessively, tugging the ear, they'll be irritable, they'll be having fever. In that case, you take the child to the hospital so that he or she will be looked at. Okay, so when the ear starts discharging,
right,
the eardrum is already perforated. Okay, and at that stage, we don't want it to become chronic. So you need to bring the child to the hospital so that we'll do this. We'll treat the child, and then it doesn't progress to the chronic ear infection that we're really worried about. Yeah.
So what you're saying now is, the moment we identify any of these things, the first thing we should do is to head straight to the doctor, right?
Exactly.
And not trying to seek our own remedies, not trying to use our own remedies, right?
Exactly.
Have you had any kind of myths about this? Are there myths and misconceptions about ear discharge?
Well, growing up, I know the common one is every child has it.
That's what you say.
They will tell you every child will, at one stage or at one point in time, develop ear discharge. It's normal.
Okay.
Yes. In fact, that was what we grew up knowing, that ear discharge is a normal thing. Okay. So that is a very wrong notion. It is not normal. When you have a discharging ear, it is very abnormal. It is dangerous because the ear is very, very proximal to very critical structures. You have the brain there especially. And this infection can spread to the brain. So
can ear discharge be a sign of a much more serious underlying condition?
A much more serious
underlying
condition.
Yes, you mean it?
Yes, sir.
So is it connected to any, what other kind of disease can it be connected to? I was just thinking,
yes, it's
just for ear, loss of ears and all of that.
Yes, because I just told you that, children with measles can have otitis media. Children, all these immunizable diseases, measles, pertussis, diphtheria, okay, these are very, very serious illnesses, and they can come down with ear infection. So, don't just look at ear discharge that, it's just ear discharge. There may be an underlying, systemic disease. The child could be having retroviral disease,
okay,
HIV, it could be having diabetes, it could be the first time that we'll get to know that the child has sickle cell disease.
Right.
Yeah.
Okay, so is it every case that leads to hearing loss, or can it be cured?
It can be cured. It can be treated.
It can be treated
very, very well. And we've been, in fact, since I came to RJOLAD, I've managed quite a few, and the parents sincerely are happy.
All right.
With the outcome. So it's something that can be managed.
Okay, then just hold on a second. Lagos Traffic Radio 96.1 FM. We're trying to understand and address ear care. I'm talking about ear discharge in children. And my guest, who's from RJOLAD Hospital, Dr. OBEBE France AMEH. He was an ENT surgeon, an ear, nose, and throat surgeon. He's really, really taking us to the classroom this morning. We'll talk about what RJOLAD is bringing to the table. But let's get back to the roads and let you in on how you can navigate this beautiful Friday morning. Those of you around the Beja corridor, I understand it's still fairly good. But of course, we're trying to find out what the report about that accident on Kara Bridge I'm not getting any feed that relates to that at all. But let's look at a review from the Papa end. I understand presently we're experiencing very high influx of export trucks along the Creek Road as well as Wharf House Road inwards at the port gate. So it's very, very busy within that corridor. Activities are being regulated and of course they are being streamlined to one lane as well. Closely monitored by the traffic managers within that particular corridor. However, there's seamless traffic flow as well from all other categories of vehicles just for our and for your consumption as well. So if you are heading inward to Papa, that's what you will find this morning. All right, so the earlier reported impediment at Maryland has been managed out of the location, moving towards the Lasma removal yard at Oshodi. Having a little bit of delays along that route, but no major worries. We talked about that earlier on as well. So it's going to be much better any moment from now. All right, then. So if you also want to ask Dr. Ami one or two questions, feel free to connect with us this morning. And that's on 091 5387 7127. That's 091 5387 7127. And of course, he's always here to respond to you. Okay, feel free to do that as well. All right, then we're moving on. 08099120777. Traffic manager, hello there.
Yes, traffic manager Awotola from Ojodubaga.
Yeah, talk to me, Awotola.
Yes, the reported accident at Kara Bridge now has finally been taken off the road now.
Oh, good.
So normalcy has
been restored
on the road. Yeah, that is the update for now. Thank you.
All right, thank you so much for that. Awotola is sending in that in-swinger from the Kara end. We did talk about an accident there earlier on, so he says it has been resolved, so it's much better within that particular corridor right now. All right, so we're talking about air care, so talk to me, air discharge rather, especially in children. If you have any questions for Dr. Ami, feel free to connect with us. So, Dr. Ami, let's talk about RJOLAD and what you guys are bringing to the table. How do you guys handle air discharge for children?
We currently, like I told you, we have quite a number of cases of air discharge that we've successfully managed. And ear infection for us is something we manage very well, with simple, cost-effective measures that are evidence-based, scientifically based. So that is not an issue, okay? For us, we're even looking at the bigger picture. The management of RJOLAD currently is looking at how to set up, a center incorporating the ENT surgeon as well as the pediatricians, that is the doctors that look after children. Want to be able to pick hearing loss at a very, very tender age, so that such children can be rehabilitated, as early as possible, so that these children can, go to school and learn, and become somebody in the future. All
right, somebody sending a message here. So it says, good morning, Victor and Dr. Ami. How can parents differentiate between normal earwax concerning discharge? Emilia is sending this one in from Bagada. Emilia, thank you so much. Okay, that's a concerned mother. So, is there any difference?
There's a big difference. Earwax is brownish.
And it's thick, right?
It's very thick. You see, it looks very thick and waxy. That is the liquid form. Sometimes these airways could become impacted, become solidified and impacted, just get impacted in the ear like a stone.
So let me ask you, is it right for one to be cleaning the ears of this wax?
It's a very wrong practice.
It's wrong?
Yeah, the ear naturally
But it feels very uncomfortable sometimes.
No. The ear naturally cleans itself. Yes.
So we shouldn't be touching it at all?
We shouldn't be touching it. It cleans itself from inside outward. We don't have eyes beside the ear to see what is happening. So as it's cleaning it, those trapped deads and germs, they gradually fall off.
So they eventually come out.
Yeah, but so in the process of cleaning the ear like we always do, it's like you're pushing them backwards. Don't come out. Don't come out. And that's one of the major cause of impacted was gradually they go and get stuck in the ear, and they could cause ear pain, and so on.
Is flushing right? When you flush the ears?
We do it as part of...
as professionals?
Yes, as part of treatment for earwax and a whole lot of other disease conditions in the external ear. But it's not something for the public to go and do.
All right. There's another message here says, good morning, Victor. At what point should a parent seek medical attention for their children's ear discharge? Thanks, Chioma. Chioma, thank you so much for that. So at what point should you do that?
Well, I like to urge our parents out there to not to even allow it get to that stage of ear discharge. When a child starts having fever, pulling the ear excessively, being irritable, that is for those that cannot talk, you quickly take the child to the hospital so that he or she can be looked at.
All right.
For those that are old enough, they will tell you. 3-4 years will tell you, Mommy, my ear is paining me.
All right.
Yeah, so you need to have that looked at. If not, in the next 2 to 3 days, the ear will start discharging.
This one says, good morning, and TGIF. Doctor, how effective are over-the-counter ear drops in managing symptoms? Oh, you didn't put your name, but thank you so much. Yes, so we have a lot of over-the-counter kind of prescriptions, doctor. So how effective are these ones?
Like I mentioned earlier, one thing our people do so much is when they start having ear discharge, not just ear discharge, ear pain or anything like that, they quickly move to the patent medical store, and the first thing, I guarantee you, the first thing they'll give them is an eardrop, likely a gentamicin eardrop. That is a very wrong practice. You have to make a diagnosis first. That ear must be looked into. Okay, you have to do an otoscopy, look into the ear, what is inside the ear, and then offer the correct treatment. Okay, like I told you, some of these eardrops are even ototoxic.
Wow.
Yeah, they are capable of killing the ear. The child can just end up with hearing loss just from using those eardrops. So it's a wrong practice. Please, people should.
Disease from it.
Disease from it.
All right, then 09153877127. Gradually winding to the end of the program. Another message here says, Dr. Ami, what preventative measures can parents take to reduce the risk of ear infections? And how is it true that exposure to secondhand smoking can affect ear health in children? Precious is sending that one in from Yanokwaja. So, secondhand smoking, what does that mean?
I guess that is passive smoking.
Okay, passive smoking.
Yeah, parents who have their children around and then they smoke around those children. Yeah, researchers have actually shown that children, who are exposed to passive smoking come down repeatedly with ear infection. So that is very, very true.
So it's very true.
Yeah, so please try as much as possible not to smoke around your kids.
Right.
That is not healthy for them. And then the other question she asked, I think, is how to prevent.
Yes, preventable measures.
Yes, preventable measures, very, very key. When your child has upper respiratory tract infection, catarrh, commonly, please, as much as possible, quickly take him to clinic, for that to be addressed. If not, the next thing you have blockage of the eustachian tube, and then ear infection will set in, and then ear discharge.
Right.
And then for our mothers who have very young babies, neonates, please, exclusive breastfeeding. Exclusive breastfeeding has been found to be protective against otitis media, ear infection. It's been found that women who breastfeed exclusively for the first 6 months, that their children are very unlikely to come down with ear infection.
All right.
As against their counterpart who do not. And then, of course...
is there a way, itching of the throats, is there any connection with the ear?
Itching of the throat is a common symptom you see in allergy.
Okay.
Those with allergic rhinosinusitis, commonly they have itchy throat, not just itchy throat, they have itchy nose, itchy ears as well. And then, of course, those with allergy are also predisposed to having ear infection, because that tube that connects the middle ear to the back of the nose can easily get blocked as a result of the allergy, and then they can come down with ear infection. So if you have itchy throat, itchy nose, and all that, you need to see an ENT doctor, and so that it can be managed. I'm sure that may be an allergic rhinosinusitis.
All right, so as we round this up right now, Dr. AMEH, what kind of screening can one do for the ear, and how often?
Yes, especially for you guys who work here.
Yes.
Yes, those who are constantly exposed.
Making use of headphones and all of that.
Exposed to noise. You need to have your ear checked regularly.
How often?
Hearing assessment. I would say at least once a year.
Okay.
Yes, you have, your ear checked once a year. We look at the ear, we do a hearing assessment for you. We keep it. We document it and put it as a record for you.
All right.
Next year when you come, we repeat, we compare it, to the previous one.
Yeah, I think it makes a whole lot of sense, really, because we are very, very prone to that since we are making use of this kind of devices.
Not just you guys, even those in other occupations, those operating heavy machines in the industries, and so on. Okay, so let's round this up right now. So what's your message? What's the parting thought to our listeners this morning as it relates to ear discharge, especially for children? Yeah. What's the message? So ear discharge is not innocuous. It's not it's not something you just look away and say, no, it will resolve. Everybody will get it at some point in time. Please, if you have a discharging ear, quickly come to the hospital. We offer such services at RJOLAD. We'll take care of you. And by the way, ENT services in RJOLAD now is 24 hours. It's 24 hours? Yes. Wow. Yes. When you come, we'll take care of you across all our branches. Which is very, very good. And you guys are located in Bagada, right? Yes, Bagada. We have another branch in Isolo, another one in Agege. Right. And technology, I mean, going online, one can easily get some kind of assessment with RJOLAD, right? But can one get anything that relates to ENT and ear care online as well from RJOLAD? I'm not sure about that. All right. I'm sure that of course we've touched on telemedicine on this program, so I have a feeling that RJOLAD will also have that as well. But let me say a very big thank you to you, Dr. OBEBE, for making it through to the program this morning. It's nice having you around, and I hope we can reflect on this very, very soon, and also bring you in once again to share your expertise with us. Thank you so much for being here. Thank you for having me. All right. He is Dr. OBEBE Francis AMEH, who's an ENT surgeon with RJOLAD Hospital. And this morning, we've been trying to understand and address ear discharge in children. And of course, we must have learned one or two things. Let's see how we can, pay maximum attention to that as well. A brief break. When we return, we'll do our birthdays before we switch to the real estate sector in Nigeria.
Have you ever